Hey guys, Nurse Sam here. So, the question, the topic of this video is, what is a nurse case manager? So let's get straight to the nitty gritty and answer that question for you guys. What is a nurse case manager? Before I begin, just want to let you guys know I am a nurse case manager. I've been doing case management for a few years now, and the whole reason why I got into it was because when I started off as a new grad registered nurse, I would take care of patients on the medical surgical floor. I had 5 patients each shift, and I just got tired of being disrespected by patients, even after I was caring for them and just being polite and helping them at their lowest point and just being for them. I can recall many times when I would come into a patient room and be like, hey, so-and-so, I got your pain medication here. Let's get rid of that pain that you have. I'm here to help you. And then the patient would be like, give me my pain medication and F you and then get out of my room, And not every patient treated me like that, but I would get instances where patients were just rude, disrespectful, and I kind of felt like I was a servant and I had no choice but to be nice to them and, take care of them. And I felt like I wasn't being appreciated. And so luckily for me, nursing is such a broad career that there's different areas in nursing that you can work in. And so for that reason, I went from doing direct patient care over to what's called case management, and I became a nurse case manager. And so the question is, and I know you guys are all wondering, what the heck is a nurse case manager? All right, let me break it down for you guys. So nurse case manager, what we do is we coordinate care for patients. So when you're a nurse case manager, one question that you always look to answer is, okay, once my patient is discharged from the hospital, what are they gonna need? Okay, so maybe a patient just had a hip fracture and they had surgery, and they still need physical therapy, and they're still not back. They're still not back to their baseline. They're not ambulating. They're unable to walk independently like they were before the surgery, and so they need more physical therapy. And so you have to think, are they going to be able to go home on their own and manage on their own? Do they have any family support at home? Or should they go to a skilled nursing facility where they offer physical therapy services on a regular basis? And so you have to think along those lines. So usually patients that need more physical therapy, they're coming off of orthopedic surgery. You kind of got to think like, okay, maybe they can't go home. Maybe they should, from the hospital, they should be discharged to a skilled nursing facility. Also, what about and sorry, my phone keeps sliding. I'm trying to prop it up. But anyways, another question you got to answer is, okay, my patient's in the hospital. They came in with respiratory distress and they were newly diagnosed with COPD. And so you have to think, okay, leaving the hospital, they're gonna need oxygen. They don't have any oxygen at home. Sorry about that. My phone's sliding. I'm trying to keep it. I'm putting it against a book in the back. And so anyways, they don't have any oxygen at home. So you as a nurse case manager got to try to get oxygen for the patient. So there's different vendors in the area that you have to look into. You can also Google, see different vendors and medical organizations that offer oxygen. So you have to make sure that you can get the oxygen delivered to the patient. Make sure that the patient's insurance is able to cover the oxygen equipment. So these are the things that we do as nurse case managers. Also, another example I want to give you guys is if a patient is dying in the hospital, they're on comfort care and maybe they need hospice. So you have to set them up with the hospice services, call the hospice agency. Hey, so-and-so, I have a patient here. I can fax you over the clinical information, and they're going to need hospice services. And maybe the patient doesn't want to die in the hospital. And normally they don't. They want to die at home where they're surrounded by family, friends, and loved ones. And so you as a case manager got to make sure you coordinate that. And also think about, does the patient have transportation leaving the hospital? And so you also have to think about the patient's insurance. Does the patient's insurance cover these services? Does the patient's insurance cover the medical equipment that they're going to need discharging from the hospital? So these are questions that you have to ask yourself as a nurse case manager. If you ask me, do I like nurse case management? I love it. Like I said, I feel like I'm still helping patients even though I'm not at the bedside doing direct patient care. I still feel like I'm helping patients, making sure that they get the services that they need so that they can continue to get continuity of care. Also, another plus to doing case management is you don't have to wipe any poop. You don't have to wipe butts. You don't have to clean urine spills. You don't have to put patients on a bedside commode. You don't have to smell C. diff. So those are all positives. At least for me, they are. I don't know about you. Some of you guys are just naturally born nurses, and you guys just have a love for being at the bedside with patients and providing care and doing direct patient care. That's great. Kudos to you guys. You guys are awesome because we definitely need you guys. But for me, that's not my thing. I prefer to do case management, coordinating care, kind of be behind the scenes. I like to stay clean, look good. So that's why I think nurse case management was a perfect fit for me. It's definitely also case management is definitely a learning curve. So there's a lot of things you got to learn, like policies, Medicare regulations and policies, and know Medi-Cal. Just have a general overview of these insurances and how they work and how they tie into the patient's care and services that they can receive post-discharge. So guys, these are kind of questions that you have to ask. It's kind of like case management is kind of like a puzzle. You're trying to put the whole, all the pieces of the puzzle together. Also, what you do as a case manager is you meet up with various members of the disciplinary team, like the doctors, the physical therapists, occupational therapists, respiratory therapists. And so with the doctor, you would kind of touch base and be like, hey, doctor, so the patient looks like he just had surgery. He just had a hip fracture, and he's coming off of the surgery. Looks like he's not progressing too well with physical therapy. Do you think we should discharge this patient to a skilled nursing facility? And the doctor, if he agrees with you, then he'll be like, yeah, let's send him over to a skilled nursing facility. And so it's your job from there to kind of send referrals out to the various skilled nursing facilities in the area and see which one will accept the patient and then coordinate discharge to that place. And so, these are just things that you'll learn as a new case manager, and everything will just start sticking together and make sense. I remember when I first started my career as a nurse case manager, I was kind of lost. I was like, so what does Medicare do? What is Medicare Part A? What is Medicare Part B? How does that work? And how do you know if the insurance covers this service? And all these questions that would come up to my head. And so these are things that you have to you'll learn on the job, and then some of these things you also have to do your own research, your own due diligence, and find out. And so is nurse case management a great job? I love it. Some people don't like it. Some people, like I said, prefer to be at the bedside doing direct patient care. Sorry about that noise. My dog has a cough. Her name's Lily. She has a kennel cough that she recently just got. She's had it for about 3 days now. But anyways, if you're thinking about doing nurse case management, you're kind of thinking of getting out of doing direct patient care, and you're looking for other opportunities elsewhere, this is definitely a good option. And like I always say, I'm out. Peace out. If you guys have any questions or comments, feel free to message me. Or if you guys have any questions, put them in the comment section below. I'm out.